African American. He's divorced. His religion is Baptist. He was admitted to Pacific Care Center on October 23rd, 2010. He has allergies to aspirin and Reglan.
Our client information, the primary diagnosis is chronic renal failure. It is caused by chronic hypertension. And then the secondary diagnosis, AFib, hypertension, and pneumonia. The AFib is a pre-existing condition that was being exacerbated by abnormal potassium levels. And the hypertension is further worsened by the continuing damage on the nephrons. And then the pneumonia is caused by a fluid retention on the body and impaired mobility.
His diet is mechanical soft, no added sodium, low potassium, low phosphorus, low protein. He has a fluid restriction of 1200 milliliters per day or 400 per shift. The diet modification and fluid restriction are ordered because of the kidney's impaired excretion.
Nice.
So our client medical and social history, he is 47-year-old, African American, has history of diabetes mellitus type 2, hypertension, AFib, and pneumonia.
So that's also a secondary diagnosis, the diabetes mellitus type 2?
Actually, it was being controlled, so he has no...
So still a diagnosis?
No,
Yeah.
no.
History.
Yeah, it's not in his. We didn't include
Yeah,
it. We didn't include diabetes type 2 in his the first
Secondary
page
diagnosis.
because this right here is in the history.
So this is...
Obviously, you never get rid of diabetes. You never. It's always with you, but it's being controlled with diet. Yeah. On his sheet, it doesn't list it. On his.
It's not listed as
No.
secondary.
Yeah.
No, it's
so
not.
it was under control,
So we omitted
as
it.
evidenced by normal blood glucose levels. So this client has AV fistula on his left arm, upper arm, and is on hemodialysis 3 times a week, and that is more or less, it takes 4 to 5 hours. And then the client lives alone in Los Angeles and has father and sister, but he lives alone, and the immediate family has a history of hypertension.
Okay. With his assessment, with the vital signs, we noticed blood pressure of 134/67, a pulse of 69, respirations of 18, temperature 97.2, and no pain. The breathing, it was regular. Upon auscultation, we noticed crackles. The O2 saturation is 95%, and the chest is symmetrical with no cough.
So, further assessment on circulation, heart rate 69, rhythm bounding, heart sounds S1, S2, or normal or regular.
So what is the rhythm? Is it regular or irregular?
Regular,
Regular?
yeah,
Regular and bounding?
and bounding.
Okay.
And then the neck veins distended because of the fluid retention, and the apical pulse is 72, capillary refill prolonged more than 3 seconds. The nail bed is pale, but there is no chest pain. There's edema, spitting, +2, and the Homan sign negative.
Okay, as far as neurological, the level of consciousness, awake and alert, and oriented ×1 to person. The Glasgow Coma Scale, for best eye opening, he scored a 4, spontaneous. For the verbal response, he scored a 4, confused. For the motor response, he scored a 5 because he localizes to pain. The total is 13.